This is a chapter review for Chapter 10, The Nervous System and Mental Health for Medical Terminology. As we start every single review, we're going to look at the combining forms related to the body system. And we're looking at the brain, which is cerebro or encephalo, the spinal cord, which is myelo, not to be confused with myo. Nerves are neuri or neuro. The function of the nervous system is to coordinate and control all the body systems. When we look at the structures of the nervous system, we're going to be looking mainly at the nerves, the brain, the spinal cord. There are some sensory organs that are affected by the nervous system, which we'll be talking about in their own chapter, but those are eyes, ears, nose, skin, and tongue. There's two different parts to the nervous system. The first is the central nervous system, or CNS. That includes the brain and the spinal cord. And what that does is receives and processes information from everywhere through the body. It also regulates all the activities in the body. The peripheral nervous system consists of 12 pairs of cranial nerves, 31 pairs of spinal nerves, and it transmits signals to and from the central nervous system. So as we look through the different terminology, a nerve is one or more bundles of neurons that containing brain and spinal, connecting to the brain and spinal cord with other parts of the body. There is a tract. Again, that's going to be a bundle of nerve fibers located in the brain or the spinal cord. The ganglion is a cluster of nerve cell bodies outside of the central nervous system. Innervation is supply of nerves to a specific part of the body. And plexus is a network of intersecting spinal nerves. So when we look at the nerves, we look at nerve receptors. And what they are, these sites are in the sensory organs that receive the external stimuli. These sensory neurons send that stimulus to the brain for interpretation. And when we talk about stimulus, that is anything that activates a nerve and causes an impulse to be sent to the brain. So those receptors sit there, and once that we get some type of stimulus from the outside, those receptors send that message onto the brain for it to be interpreted. The reflexes then are that automatic involuntary response, either inside or outside of the body. So this could be something scares us. That's that stimuli of a man running up to you with a gun, okay? And that scares you. So what's going to happen? That stimulus is sent to the brain for interpretation. Our body is going to have an automatic reflex of increasing your heart rate, your respiratory rate, and your blood pressure. Because what's going to happen is your body's getting you ready for either fight or flight. And we'll talk about this in a little bit. It also is a response to painful stimuli. So we touch a hot pan and the brain sends those signals, or the body sends those signals to the brain, and we automatically jerk our hand away because our body's telling us that that's hot. There's basic cells of the nervous system, and this allows different parts of the body to communicate with each other. So we have dendrites, which carry impulses towards the cell body, and then we have an axon that carries impulses away from the cell body. Then there's terminal end fibers, and these fibers are at the end of an axon, and they lead a nerve impulse from the axon to the synapse. And what the synapse is then is the space between two neurons, or between a neuron and a receptor organ. When you think about how the nervous system works, it really is quite interesting, because to think that we touch a hot pan and that stimulus goes to the brain and then back down to our hand within microseconds, so we pull our hand away, is pretty amazing. Neurotransmitters, these are actually the chemical substances that allow messages to cross from a synapse of a neuron to a target receptor. So you're going to hear these a lot if you're working in different areas of healthcare. It's acetylcholine, it's dopamine, endorphins, norepinephrine, all these things you'll hear. A lot of times you'll hear people say, if you exercise, you increase your endorphins and you're happier. And again, that's a chemical in the body that we can actually increase when we do certain activities. The glial cells have 4 functions. They actually surround the neurons and hold them in place. They supply nutrients and oxygen to the neurons, because without those nutrients and oxygen, those neurons can't function. They insulate one neuron from another, and if a neuron dies or gets destroyed, it gets rid of those for us. Then we have the myelin sheath, and the myelin sheath is a protective covering that goes on those glial cells. So we can have myelinated nerve fibers, which they call white matter, or myelinated, which means having that myelin sheath, or an unmyelinated nerve fiber, which is gray matter, and those unmyelinated nerves have no myelin sheath covering them at all. So, talking about the central nervous system, we know that the brain and the spinal cord are in the central nervous system, and that is externally protected by the bones of the cranium and the vertebrae of the spinal column. And we talked about this in the skeletal system, that those bones actually protect our vital organs. So we have the meninges. Again, they are enclosed in the brain and the spinal cord. And there's actually 3 layers of the meninges. The dura mater is the outside membrane. The arachnoid membrane is the second layer. And the reason they call it the arachnoid membrane is because it resembles spider webs. And we know that in the world of insects, an arachnoid is a spider. And then we have the pia mater, which is the inner layer, and that's closest to the brain and the spinal cord. Then we have cerebrospinal fluid, and this cerebrospinal fluid is necessary for us to be able to have our brain working correctly and our spinal column working correctly. It's produced in the 4 ventricles in the middle region of the cerebrum, and it's a clear, colorless, watery kind of fluid. Its function is to cool and cushion the brain and spinal cord. And again, it also nourishes the brain and spinal cord and transports nutrients and chemical messengers to the tissues as well. So when we look here, this is just, here we go with a cerebrum, this large part here. Here is our cerebellum down here. We're going to be talking about these different parts of the brainstem here shortly. Here's our spinal column. So we have the brain, we have the brain stem, we have the spinal cord, and here we have tucked in here the cerebellum. The brain is divided into 2 parts. We have the right cerebral hemisphere and the left cerebral hemisphere. Remember, when we're looking at this, this is the patient's left and right, not our left and right. So when we talk about the cerebellum, it is the largest and uppermost portion of the brain. And it has a lot of responsibilities. It's responsible for our thought, our judgment, memory, emotion, and it integrates our motor and sensory functions. There is a cerebral cortex, and there's different parts again as we talk about that. And the outer layer of the cerebrum is made of gray matter. Then we have the gyri, which are the folds of the gray matter as we look at the cerebral cortex. Then we have the sulci, and these are fissures within the cerebral cortex. And we'll be talking about fissures as we get into the integumentary system, but they're like a really deep crack-like sore, and that can be very problematic. So again, we have this cerebral hemispheres, and we have the left hemisphere. And when we think about this, the left hemisphere actually controls the right side of the body, and the right side of the brain controls our left side of the body. And at the very low point of the cerebral hemispheres, it's actually connected by the corpus callosum. So when we talk about the different hemispheres in the brain, there are 4 that we're going to talk about. We have the frontal lobe, no, more than 4, sorry. Frontal lobe, which actually controls our skilled motor functions, our memory, and our behavior. The parietal lobe, which actually receives and interprets the nerve impulses from our sensory receptors, like our tongue, our skin, and our muscles. Our occipital lobe controls our eyesight. The temporal lobe controls sense of hearing and smell. And it also controls the ability to create, store, and access new information. So when we talk about these different parts of the brain, the temporal lobe, the frontal lobe, the parietal lobe, the occipital lobe, if you have some type of injury or disease, let's say we have some type of issue with our temporal lobe and we can't store current information. We see this a lot with patients with Parkinson's or Alzheimer's. They can remember things that happened in the past, but they're not remembering things that happen now and storing them into their memory. Again, if we, in that occipital lobe, if we injure it, it may affect our eyesight. So depending where the injury is in the brain, it could control what is happening with the body. The thalamus is located beneath the cerebrum, and what it does, it relays the impulses to and from the cerebrum and to the sense organs. The hypothalamus is incredibly important. The hypothalamus actually regulates our autonomic nervous system. It regulates our emotional responses. It's very important in our body temperature regulation, which is huge. Food intake and water balance. It affects our sleep wakefulness cycles and our pituitary gland and endocrine system activity. So the hypothalamus plays a huge part in homeostasis. The cerebellum is the second largest part of the brain, and it's located in the back of the head below the posterior portion of the cerebrum. It's going to receive messages regarding movement within the joints, our muscle tone, and the different positions, and it coordinates the movements. It maintains equilibrium and helps us sustain normal posture. So a lot of times you'll get people who have really difficult times being able to stand and not be able to get, fall over. That's because they're having problems with that cerebellum. The brainstem is it's a stalk-like part of the brain that actually connects the cerebral hemispheres to the spinal cord. And there's 3 parts to the brainstem. The first 2 are the midbrain and the pons. And those control reflexes for the eye movement and our head movement in response to visual and auditory stimuli. So when we see or hear something, that's going to go through the midbrain or the pons. The medulla oblongata is in control of our basic survival functions. So if we have an injury to this medulla oblongata, we may not be able to breathe any longer. It controls our respiration. So it also includes our reflex for coughing, sneezing, vomiting, and swallowing. So while we would love to forget some of those things like the vomiting and the coughing and sneezing, it's very important for us to be able to swallow and breathe. The spinal cord is actually like a tube-like structure that begins at the end of the brain stem and goes down to almost the very bottom of the spinal cord. Okay. It is always surrounded by cerebrospinal fluid and the meninges, and it is the pathway for the impulses to and from the brain. Now, when we talk about the peripheral nervous system, we talked about the 12 pairs of cranial nerves extending from the brain. We have 31 pairs of spinal nerves extending from the spinal column. And there's 3 specialized peripheral nerves. We have autonomic nerve fibers, we have sensory nerve fibers, and we have somatic nerve fibers. When we look at those autonomic nerve fibers, they actually carry instructions to the organs and the glands in our autonomic nervous system. Our sensory nerve fibers receive external stimuli about maybe how something feels, and it transmits that information to the brain as interpreted. And then the somatic nerve fibers, which we also know as motor nerve fibers, convey information that control the body's voluntary muscular movements. Cranial nerves originate under the surface of the brain. They're identified as Roman numerals, and when you take anatomy and phys, you're going to be hearing all these crazy different mnemonics to remember it on old Olympics, towering tops, a fin. It's crazy. Any way that you can remember those so you know those for anatomy and phys. They are named for the area or function that they serve. The nerves of a pair are identical in structure and function, and each nerve of a pair serves half of the body. The peripheral spinal nerves are again named on the region that they innervate. So we refer to them by number. And we've talked about this in the musculoskeletal chapters. The first are the cervical spinal nerves, the C1 through C8. Then we have the thoracic, which is T1 through T12, the lumbar, which is L1 through L5, and sacral, which is the S1 through S5. So I just talked a little bit ago about that medulla oblongata, where it's right at the base of the brain. So when we have a high cervical break, like a C1 or C2, that's why it can affect the respiratory center of the brain, because if it has affected part of the medulla oblongata, the body may not be able to breathe on its own. Or it can actually be affecting the nerves to the diaphragm, which don't any longer allow them to be innervated. And we have to have that diaphragm moving up and down in order for respiration to take place. The autonomic nervous system controls our involuntary actions of the body, and there's 2 divisions. There are the sympathetic nerves, and we talked just a little bit ago about the fight or flight, and it's what gets our body ready in case of an emergency. So it's going to increase our respiratory rate, increase our heart rate, increase our blood flow to the muscles that we need to either flee or to fight. So it's going to shut down the blood flow to like the fingertips, to the digestive system, because we don't need that in a fight or to run. Where we need the oxygen to be sent is to our heart, to our lungs, to our large muscles that we're going to be able to use if we run or if we hit somebody. Now, the parasympathetic nervous system actually is the system that returns our body to normal after we have one of these stress responses. So Our body, the parasympathetic maintains our body function when there's no emotion or physical stress. But what we see now, people carry stress all the time. So you're stressed about school, you're stressed about money, your car's broken down, you're fighting with your boyfriend or your spouse or girlfriend. And so what that does is it puts our body in that sympathetic nervous system where we are in fight or flight, and all that blood flow is going to the brain, it's going to the lungs, and it's decreasing in the digestive system and other areas of the body. That's why our bellies get so upset when we are, stressed, because there's not enough blood flow to help work the GI system like it's supposed to. So what we have found, I've been doing mind body skills for quite a few years. And what we have found is if we can learn through breathing, through meditation, through different activities to trigger that parasympathetic nervous system, that helps us the body relax and bring that body down back to normal. And we do that by taking deep breaths. If we breathe in through the nose and out through the mouth, we're actually triggering the vagus nerve. And the vagus nerve is essential in that parasympathetic nervous system. That vagus nerve is what allows our body to relax. So simply by learning how to do deep breathing, you can actually take your body out of a stress position and bring it down to where our body is no longer stressed. It's pretty amazing. And there is so much scientific data. This is not frou-frou crazy stuff. There is actually scientific data that proves this, and it's absolutely amazing. I'll get off my soapbox now. So we're going to look at medical specialties related to the nervous system. We have an anesthesiologist. This is a doctor that specializes in giving anesthetic agents during surgery. In order to do that, they have to not only be a doctor, but they have to do additional training to become an anesthesiologist. And then we have an anesthetist. And an anesthetist is actually a medical professional who actually specializes in administering anesthesia. So this can be someone that goes to anesthetist school. They work in tandem with the anesthesiologist. The anesthesiologist may have 3 or 4 rooms, but it's actually the anesthetist who is giving the anesthesia. Neurologist is a specialist who diagnoses, treats disorders and diseases of the nervous system. And neurosurgeons specialize in surgery of the nervous system. A psychiatrist specializes in diagnosing and treating chemical dependencies, emotional problems, mental illnesses. And a psychologist specializes in evaluating and treating emotional problems and mental illness. They can have a doctoral degree, but they do not have they are not a medical doctor. And this is really important to know. There are some psychologists or therapists that may have a master's degree as well. So when we look at the pathology or the disease state of the nervous system, we can have so many things that happen. So cephalgia is actually a headache. That's the medical term for a headache. It's pain in the head. Okay, if we're going to define that using medical terminology. A migraine headache, again, that is where it is an extreme headache. You can get nausea, vomiting, sensitivity to light. Some people may see auras around, as they look, they can actually see auras as a precursor. They know it's coming on. We see something called cluster headaches, where we are repeatedly getting headaches, but just on one side of the head. Encephalocele is actually a congenital hernia of the brain tissue through a gap in the skull.
A meningocele is a congenital herniation of the meninges through a defect in the skull. And then we have hydrocephalus. And hydrocephalus is where we have excess cerebral spinal fluid in the ventricles of the brain. Normally, what happens is it flows from the brain through the spinal cord, and sometimes there's a little bit of a blockage where the fluid can't drain. So, what they do with hydrocephalus is actually go into the head, do a shunt. They go past that blockage just like they do with a bypass surgery with the heart, so that fluid can flow freely within that nervous system. The meningiomas is a slow-growing, usually benign tumor of the meninges. Meningitis is actually the inflammation of the meninges of the brain and spinal cord. It can either be viral or it can be bacterial. It can be either or. That's usually why they do a spinal tap, to see if it's a bacterial. If it's bacterial, they can treat it with antibiotics. If it's viral, they may treat with antivirals, but they usually will kind of see how the patient goes. Dementia is a progressive decline in mental abilities, often accompanied by personality changes. And again, we're starting to see onset of dementia becoming in a younger and younger age. So it's going to be interesting to see if they can figure out why. There's vascular dementia, and that's caused by a stroke or other type of restriction to the blood flow to the brain. Encephalitis is an inflammation of the brain. Reye syndrome, you hear a lot about that. It may follow a viral illness in children if you treat it with aspirin. That's why they tell us now, never give children aspirin. They should have either acetaminophen or ibuprofen, but don't give children aspirin. We have the good old tetanus, which is a potentially fatal infection of the central nervous system, because what it does, it produces a toxin from the tetanus bacteria, and it actually gets systemic and it can be fatal. That's why you need to get a tetanus shot regularly. Tourette's syndrome is a neurological disorder that's characterized by involuntary movements and sounds. They'll be called tics. And so the patient may just have a tic in their shoulder. They may move their shoulder. They may move their head. Sometimes in severe Tourette's, patients will actually make noise, or they can shout obscenities. Again, it's not controlled. They're not doing it purposely. It's actually a neurological disorder. Alzheimer is a progressively deteriorating disease that it affects the memory and reasoning capacities. It's very sad. It's more difficult usually for the family than it is for the patient, because the patient is in their own world. But they don't remember family members, they don't remember names, and it's very difficult for the family members of patients who have Alzheimer's. Parkinson's is a degenerative disorder that leads to progressive loss of control of our movements. It's due to an inadequate level of dopamine, which is one of those neurotransmitters that we talk about. So one of the treatments of Parkinson's is giving them some type of dopamine in the medication that they get. Amyotrophic lateral sclerosis, ALS, which is also known as Lou Gehrig's disease, is a rapidly progressive disease. And what it does, it attacks the nerve cells responsible for controlling the muscles. So they can go from being really great one minute, and the next minute they're on a ventilator and they can't move any part of their body. I used to sit with a gentleman who was the only part of his body he could move was his mouth, and he would type on the typewriter or like the computer to let me know what he needed. There's different brain injuries. Amnesia, it's a total or partial inability to recall the past. You can have a short-term amnesia or a long-term amnesia. A concussion is actually a shaking or jarring of the brain, and it can cause a temporary loss of awareness. We see this a lot in sports injuries, and that's why we constantly are checking them every hour to make sure that they're doing okay, to make sure there's no inflammation in the brain or there's no blood loss or blood bleeding in the brain. A cerebral contusion is bruising of the brain tissue due to the brain bouncing against the bone, the skull. And cranial hematoma is when we get the blood and we get a bleed in the head, and there's nowhere for that blood to go. So we have that hematoma, which is a tumor or of blood, and it's trapped in that brain tissue. And again, depending on the amount of bleeding, it can kill part of the brain tissue off. So it's very, very important that we take care of those. Traumatic brain injury, it can be from a mild case to a very severe case. And we see traumatic brain injury with shaken baby syndrome. We're seeing it more and more, unfortunately. It can result in brain injury, blindness, fractures, seizures, paralysis, and if it is truly a severe case, it can even lead to death. There are different levels of consciousness. So if we're conscious, we're alert, awake, and we respond appropriately. If we're unconscious, we are not able to respond to any stimuli. Lethargy is, or if you are lethargic, it is a lower level of consciousness. You're listless, you're drowsy, you're kind of apathetic, you're just like blah, you're just slow. A stupor is when you're unresponsive. You only briefly arouse despite repeated attempts. So you can shake somebody, and they may go, huh, once in a while, but that's called a stupor. Syncope is fainting. That's the medical term for fainting. It's a brief loss of consciousness due to a decreased blood flow in the brain. A coma is a very deep state of unconsciousness. There is no spontaneous eye movement or response to painful stimuli or speech. Again, we have seen some miracles where people come out of comas after many, many years. And that's why people sometimes hesitate to let somebody go, because they're hopeful that they will be one of those very few cases that people come out of that coma. Persistent vegetative state, that is when you alternate between wake and sleep cycles, but the person's actually unconscious. Excuse me, delirium is an acute confusion. They are totally disoriented. They do not have normal thinking. It's very disordered. They are agitated and they are hallucinating. So if a patient is delirious, it can actually be a very, very dangerous situation because they do not know what's going on. Different types of brain tumors that we're going to see. There are malignant brain tumors, and again, not a good thing because it's going to destroy the brain tissue. If you have a tumor growing in there, it's going to be pushing out on the brain tissue, and because the brain is enclosed in the skull, there's only so much room we have. And so if that tumor's growing, it's killing off the parts of the brain close to it. It can be a primary or secondary site. Remember, primary means it's the first place they got cancer. If it's a secondary site, that means maybe you had colon cancer, and then 4 years later it shows up in the brain. That would be a secondary cancer. We have benign brain tumors. It really doesn't invade the brain tissue, but it can cause pressure and damage the tissue. So we want to make sure we get that out so we don't have permanent brain loss. Intracranial pressure, again, it's the amount of pressure inside the skull. And anytime something happens that increases that pressure, and as the brain expanding, if we have a concussion or we have some type of injury, that's very, very dangerous. And what you'll see happen is they will drill a little burr hole in and be able to relieve some of that pressure, so the patient doesn't have any type of permanent injury. Stroke or CVA. CVA stands for cerebrovascular accident. Yes, I know some of the books say cardiovascular accident, but if somebody says CVA, you need to rethink of stroke. Okay? It's damage due to the brain due to some type of disrupted blood flow. And we use a mnemonic to remember what we need to look for. And that mnemonic is FAST. So F stands for facial drooping. So one side of the face is going to droop. We're going to we're going to look for arm drift. And that means if we put our arms out straight from our body in front of us, if one of our arms starts to drift down, that's called arm drift. If there's some type of speech abnormality or slurred speech, and the most important thing is time. It is so important. If you see any of those symptoms, you need to get that person to the hospital ASAP, because there are medications, if it's a blood clot, that they can dissolve that blood clot and have very minimal to no damage. So time is of the essence when we look at those type of things. An ischemic stroke is actually due to a blockage of the carotid artery. And remember, our carotid artery is going to be in our neck area. It is what they'll go in if there's some type of blockage. They'll do a carotid endarterectomy, where they'll go in and kind of root the stuff that's in there out, so the blood flow returns to the brain. A transient ischemic attack, or a TIA. What a TIA is a temporary interruption of blood flow to the brain. So people may get confused or maybe have some of those symptoms for a short period of time, and then all of a sudden the blood flow will come back and they'll disappear. And you'll go, honest to goodness, they had some facial drooping. They were slurring their speech, but now they seem normal. They simply could have had a TIA. What you want to do is have that patient checked, because that TIA may be leading to, with the onset of a TIA, they may have a decreased blood flow or some type of occlusion in the carotid artery. And so you need to make sure that we're checking that. So if there's something we can do to correct it, we do. Aphasia means we're not able to speak. And again, that is going to be due sometimes to a stroke, depending on the side of the brain that's affected. If we have right-sided brain damage, we're going to see left-sided paralysis, memory deficits, and very impulsive behaviors. If we have left brain damage, we're going to see a right-sided paralysis, memory deficits, slow behavior, and speech. So when our left side of the brain is affected, that's when we're going to see issues with speech. A hemorrhagic stroke is when it's leaking of a blood vessel. So maybe a blood vessel has an aneurysm and it breaks, and we have blood flow to the head. An arteriovenous malformation is when there's an abnormal connection between the arteries and the veins, and it can burst, and then we can have major issues. There's different sleep disorders out there. Insomnia is just a prolonged or abnormal inability to sleep. Could be caused from a number of different things. Narcolepsy actually is different. It's a sudden, uncontrolled episode of falling asleep during the day. People can be talking to you and they can stop and they are out cold. They'll wake up maybe 20 minutes later and then they act like nothing has happened. So they can sleep at night without any problem, but they have that uncontrolled episodes of falling asleep during the day. Sleep deprivation is a lack of restorative sleep that actually affects us physically and psychiatrically. This is really, really important to remember. We need to sleep in order for our body to store memory. So when you guys are staying up and cramming for exams and don't sleep, your short-term memory is not going to be stored. So it is better to get a good night's sleep and study over a longer period of time than to cram at the end of the semester to try to remember everything, because your body will not help you at that point. Somnambulism is sleepwalking. That's where you get up and people are walking and they are still sound asleep. Myelitis is an inflammation of the spinal cord. Myelo can also mean bone marrow. So when you're looking at medical terms, look to see which definition should be used. If we're talking about inflammation of the bone and bone marrow, that's different than if it's referring to something in the spine. So you need to be careful on how you define that term. Myeliosis is a tumor of the spinal cord. Poliomyelitis is a viral infection of the brainstem and spinal cord that can lead to paralysis. Radiculitis is an inflammation of the root of a spinal nerve that causes pain and numbing, radiating down your arm, leg, whatever it may be. So it's going to be named for the area it's affecting. So if it's a cervical, it's radiculopathy, or lumbar radiculopathy. Multiple sclerosis is a progressive autoimmune disease. What happens with multiple sclerosis is that myelin sheath is attacked and it is eaten away, and that happens in the brain, the spinal cord, and optic nerves. That scarring then disrupts the transmission of the nerve impulses, and so people lose function of their body, movement and those type of things. Bell's palsy. Bell's palsy is actually a temporary paralysis of the cranial nerve. And when we see Bell's palsy, we actually will see a drooping of the eye, maybe a little bit of drooping of the cheek. Guillain-Barré is an inflammation of the myelin sheath of the peripheral nerves. It starts with muscle weakness and it can lead to temporary paralysis. A lot of times we see this right after a viral infection. Now, with Guillain-Barré, we usually see it start at the feet and spread to the upper body. Myasthenia gravis is similar, but it starts at the head and moves down. So Guillain-Barré starts at the feet and moves up. Oops. All right. Neuritis is an inflammation of the nerve. Sciatica, oy vey. I'm telling you, the sciatic nerve is a huge nerve that runs from your the bottom of your spine down into your leg, across your butt, down into your leg. If you have an inflammation of the tissue surrounding where that nerve goes through, it is a horrible, horrible pain. People say it burns, it hurts, it will cause their leg to go numb, but it is very, very, very uncomfortable. Trigeminal neuralgia is pain due to the inflammation of the fifth cranial nerve. Cerebral palsy. Cerebral palsy is when you have poor muscular control, you may have spasms, and you could have some speech deficits due to the damage of the cerebrum. We see this in some premature babies and low birth weight babies, and it's usually caused by injury during pregnancy, birth, or soon after. So a lot of times people will have somebody delivering the baby that may have caused some type of illness or disorder, and they have cerebral palsy. There could be other things too, but you'll see a lot of people sue when their child's diagnosed with cerebral palsy. Epilepsies and seizures, this is really something that we see a lot. Again, a seizure, it's when they have a surge of electrical activity in the brain. Okay, so all of a sudden, all the electrical activity in the brain goes crazy, and it will cause a seizure. And we have different types of seizures. We have a tonic-clonic seizure, which used to be called a grand mal seizure. That involves the whole body. So first of all, the body becomes rigid, which is the tonic phase, and then the clonic phase is when that uncontrolled jerking starts. Then we have the absence seizure, which is called a petit mal seizure. And this is just a little bit of a brief disturbance in the brain. It can be a loss of awareness, but we don't see that those, the jerking with that. Some people will just have a seizure, can sit there, and you can just see their eyes go back and forth. They're really not responsive to you, but that's all that happens with them is their eyes will just go back and forth. You have to be very observant to see that. Causalgia is persistent burning pain. Hyperesthesia is, again, excessive feeling. So this is if somebody has excessive or abnormal sensitivity to touch or pain. Paresthesia is burning and prickling sensations in the hands, arms, and feet. Peripheral neuropathy is something we see a lot with diabetic patients. We see it a lot anyway, but this is really tied with our diabetic patients. What happens is it produces a loss of sensation to their legs, to the lower part of their body. So they don't feel their feet or their lower legs at all. This is a real problem for our diabetic patients because if you and I are walking and we know our foot hurts and our shoe is causing a blister, we can take care of that. If you can't feel your foot, you don't know you have a blister. And with diabetics, getting taken care of, any type of wound care is incredibly important because diabetics don't heal well. So if they don't know they have that blister and they let it go for days, they can actually get to a point where they lose part of their foot, their amputation below the knee, or possibly the whole leg. So it's really important when we look at that we are making sure there is no type of open sores or any type of problems on the lower legs because they can't feel it. Restless leg syndrome is when they just have constant movement in the legs at night and even during the day. We notice it more at night because we're trying to sleep. And all of a sudden we're sleeping and our whole body jerks and it wakes us up. So we notice it a lot more. Some of the diagnostic procedures that we're going to see is an MRI or a CT. A functional MRI, what that does, it looks at the changes of blood flow in the brain. So what they'll do is ask a patient to perform a specific task, and they expect to see the blood flow go a certain direction. If that doesn't happen, they know that there's an issue. A carotid ultrasound is when they're going to use the ultrasound and look at the plaque buildup on the carotid artery. An encephalograph or encephalography is using ultrasound to create an image of the brain for diagnostic purposes. Electroencephalography, that's when we put all those electrodes on somebody's head and we watch the activity of the brain. It is absolutely amazingly cool to watch that, and you can see how the brain works. Even in sleep, you can see how the brain works, and it is amazing. If we see that and there's a certain part of the brain that's not functioning properly, they're able to see that on this EEG. This is called an EEG, electroencephalogram or electroencephalography, EEG. A myelogram is actually a radiologic study of the spinal cord. We have to use a contrast, and they do that through a lumbar puncture. Oh, I don't think I did that right. Hang on. Electromyography, it uses electrodes taped to the skin to measure the transfer of electrical signals of the peripheral nerves to the muscle. So they're going to actually be testing to see if you can feel anything. And a lumbar puncture is when they insert a needle into that subarachnoid space of the lumbar region to get a specimen of cerebrospinal fluid. Different types of treatment for the nervous system. We have different types of medicine that are available to patients. And this actually starts on page 318. There are hypnotics. And what hypnotics do, it depresses the central nervous system and helps us produce sleep. So we can think of things like probably Ambien, something along those lines. Anticonvulsives actually prevent seizures. So those medications help stop the seizures once they figure out what the cause is. Then we have barbiturates. And the barbiturates actually are a class of drug. It's going to be a controlled substance that produces calming or depressed effects on the central nervous system. Then we have a sedative, which depresses the central nervous system to produce calm and diminished responsiveness. This is not used to produce sleep, okay? That's left for the hypnotics. Anesthesia, again, when we look at the term anesthesia, it means the absence of normal sensation, especially the sensitivity to pain. So an anesthetic is something that we use to have the patient not feel pain. It can be topical. We can put it on the skin if we need stitches. We can do a local area if it's a larger area. We can do a regional one. We can do a block of the whole arm if we don't want to have to put the patient to sleep. Or we can do a general anesthesia, which is putting the patient to sleep. An epidural anesthesia is different than a spinal. We'll talk about both of those. We inject the medication into the epidural space for an epidural or sacral region of the spine. And what it does, it numbs the nerves of the uterus and the birth passageway so women in labor can deliver without feeling pain. It does not slow down, hopefully, the labor process. Now that's different than a spinal because a spinal is regional anesthetic produced by injecting medicine into that subarachnoid space, and it will actually numb you from your waist down or wherever it's given. It's going to just, you won't feel a thing. You're awake, you just don't feel anything. Deep brain stimulus, again, it is a surgical procedure to treat tremors, Parkinson's. They actually go in and stimulate different parts of the brain to see where the problem's coming from, and then they try to treat that. They try to take out that part that's not working correctly. Gamma knife surgery is radiation treatments for brain tumors. They go in and use that gamma radiation to destroy diseased tissue that's in the brain. Electroshock therapy or electroconvulsive therapy. This used to be used all the time. When I first started in the field back in the 80s, we used electroshock therapy all the time. And you guys probably never saw One Flew Over the Cuckoo's Nest, but that's when they put the thing on the patient's head. They actually cause them, they put amounts of electricity, and what they're trying to do is reverse the symptoms of that mental illness. We are starting to see a comeback of electroshock therapy, believe it or not. I don't know how effective it is because I don't work in the mental health field, but we are seeing a resurgence of that. A lobectomy is just a surgical removal of a portion of the brain. That can be used to help treat brain cancer or seizure disorder if we can't control that with medication. A thalmotomy is a surgical incision into the thalamus. Now, you guys, some of you are having a real hard time with otomy, ostomy, and ectomy. Otomy is the surgical incision. Ostomy is an opening to form a mouth, and ectomy is a surgical removal of. So it's really, really important that you learn those three. They're the three most missed suffixes in medical terminology. A transcranial magnetic stimulation. Again, they use really strong electromagnetic pulses to try to alter the electrical pathways of the brain. I have never seen that done, but it sounds pretty cool. Neuroplasty is going to be the surgical repair of the nerves. Neuroraphy is going to be the surgical suturing of together of severed nerves, and neurotomy is a dissection of or cutting into the nerve. Mental health issues. Mental health issues are diagnosed out of the DSM, which is the Diagnostic and Statistical Manual of Mental Health Disorders. There are a number of different mental health disorders. One is general anxiety disorder, GAD. It is chronic and excessive worrying. And this can be very much influences people's lives. There's a panic disorder where people are afraid of getting a panic attack, but then patients have panic attacks. And this is when somebody has a sudden fear, even if there is no danger around. And I will tell you, when you see this, it's pretty scary, because that patient truly is afraid, even though there's nothing there for them to be afraid of. Post-traumatic stress disorder. This happens after an event that actually really makes a person feel fearful, helpless, or horrifying. Sorry, I had a tickle in my throat. So this can happen. A lot of people think that this is just reserved for people who have been in the military. This can happen to anyone. Walking in and seeing somebody who was talking to you 5 minutes ago, and now you walk back in the room and they're gone, or have died. People who have seen horrific things happen, people who have been abused. A lot of people suffer from post-traumatic stress disorder. Acrophobia is the fear of heights. Agoraphobia is the fear of going outside the home. So it's people that don't want to leave. Claustrophobia is a fear of small enclosed spaces. And social anxiety disorder is an excessive fear of social situations. So that person may be able to go out, but they don't want to go out in very big social areas. We have obsessive compulsive disorder, and people who are OCD, again, that's the acronym for it. They have recurrent obsessions and they repeat things. So this person may have to touch a light switch 3 times in every room before they can turn it off. We've seen patients who it takes 25 minutes for them to leave the house because they have a ritual of having to touch things, and they've had to learn how to either leave earlier so they can do their ritual, or we've tried to get them to therapy to try to help them work through their obsessive compulsive disorders. Hoarding disorder, they have television shows on this now where you can see hoarders. They keep everything, and it gets to the point where it absolutely interferes with their daily living. They can't even sleep because there's so much clutter and so much junk that their bed is covered. And so they may only have a small space to sit up sleeping. So it's pretty intense. And there are therapists that work specifically with this type of patient. Attention deficit or hyperactivity order, ADHD, that is attention deficit hyperactivity disorder. Again, we see this with people who have short attention spans. There are medications that help that. They are Schedule II, and so we don't want this, like if a kid is on a medication for that, they shouldn't be taking it on the weekend. They shouldn't be taking it over the summers because they are very addictive medications. So it's important that they don't take them if they're not going to be in a situation where they have to pay attention, like in school. Because they're a Schedule II medication, they have to pick up an order at the doctor's office and take it to the pharmacy because of it being that Schedule II. Dyslexia is when somebody has a learning disability where it just jumbles the word around. So we may see a number 567. Somebody else may see it 657. So it's just when the numbers or the letters are different than what's there. Learning disabilities are children of normal intelligence, and they just are having learning specific skills. I have to tell you, this is so difficult for me because people are embarrassed that they have learning disabilities. And there's no reason there should be. We have a lot of students with accommodations, and it doesn't mean that they are not smart. It's just that they have difficulty in specific learning skills. And so there's different ways to be able to deal with them. Then we have intellectual disabilities where they do have below average intelligence and adaptive functioning, and that is problematic. Then we have autism, the autism spectrum disorder. And this is when a child has a difficulty developing normal social skills and communication skills. You're going to notice that it says it's an autistic spectrum disorder, and that's because they can go from someone who is really somebody that the kids can't talk and non-communicative and non-social to somebody who has Asperger's, who is very social, and they just may have, and very, very smart. They just may have a few of those issues. Dissociative identity disorder is when we see one or two more distinctive personalities. Sometimes people will call this split personality disorder, but it is dissociative identity disorder. Disruptive and impulse control disorders. So they can't control themselves. So kleptomania is somebody who repeatedly steals. Pyromania is somebody who sets fires. And then there's oppositional defiant disorder, and that's people who have disruptive behavior towards figures of authority. Bipolar disease, this is a disease where cycles of severe mood change shift from very high to very low. There's a manic behavior as well. It's where they have an elevated mood, but then they can get real irritable. They don't sleep. They have very poor judgment. They have inappropriate social behaviors. We may see them buy $600 pair of boots when they can't afford it. We see that. The one thing with bipolar disorder is the medications sometimes are harsh. So when they finally take the medications and they're feeling better, they stop taking the meds because they don't like the side effects of the medication. So all of a sudden they're controlled with the meds, but then they stop taking them and then they crash and burn, and then they start back with the cycles. So this is very difficult, a very difficult disorder to work with. Depression, again, lethargy, sadness. I've always loved that, not loved it, it breaks my heart when the dog comes up, that's a commercial with a ball and the guy's just not interested. We see a lot of people with depression. It is an imbalance of our chemicals in our brain. You can have short-term treatment of depression with medication, or it may be long-term, but it is just a balance. It's our chemical balance is not correct. Persistent depressive disorder, again, this is where you have a low-grade chronic depression, and you're feeling pretty low most days of the week, and it lasts about over 2 years. SAD, or seasonal affective disorder, this is when the sun is really not out a lot, and we see this in the winter months. We see this a lot of times with people who live in cultures where, like in Alaska, where it's 12 hours a day and or 22 hours of nighttime and 4 hours of day because of where they live and the rotation of the earth. There are treatments for that, light therapy, different things that patients can do. There's an eating disorders, anorexia nervosa. That is a voluntary starvation and excessive exercising, because they have a false perception of their body appearance. And bulimia nervosa is where they vomit. They binge eat and then they induce vomiting. They use laxatives, they use whatever. You can tell bulimics usually because their teeth are stained from the bile, the vomit, and they always have calluses on the fingers that they use to gag themselves to vomit. There's also personality disorders, antisocial personality disorders, where people disregard the rights of others. They don't care. Borderline personality disorders, where they have impulsive action, their mood is up and down, it's all over the place, and they have very chaotic relationships. And then we have the narcissistic personality disorder, where that person is so preoccupied about themselves, they could care less about anybody else. There's catatonic behavior. This is when a person has no responsiveness. They are in a stupor and they usually remain in a fixed posture. Delusions are when somebody has false personal beliefs. You'll hear delusions of grandeur. So there's different terms that you may hear with that. And then there's hallucinations, where people are having sensory perception even though there is no external stimulation. So they believe there is, and they are having those sensory experiences even without a stimuli. Schizophrenia is when somebody has a withdrawal from reality. There is absolute illogical patterns of thinking, delusions, hallucinations, and there could be other things that accompany it, with emotional behavior or intellectual disturbances. And this is very different. This is somebody who puts foil on their windows because they think people are listening to them and the rays are coming in and they're going to be hurt. Somatic symptom disorders. Again, this is physical complaints about a body that are out of proportion to the physical findings. This is something called factitious disorder. This is a person who acts like they are ill, even though they're not sick. So they will go out of their way. They may go to 50 doctors and say, this is what these are my symptoms. They really, truly believe they're sick, but they are not sick at all. We also see a term with this, Munchausen's. Munchausen's is when a parent feels like their child is sick. So they actually will do things to make their child sick, to get attention, take them to the doctor, get these outrageous treatments. That is something, as Munchausen's by proxy is the terminology for that. Conversion disorder is temporary or ongoing changes in function triggered by psychological factors. So something happens and people will just go blind. I mean, out of nowhere. Nothing has triggered in the world that has made them blind, but there's something that's going on that actually does that, or they could actually have paralysis. Malingering is an intentional creation of false or exaggerated physical or psychological symptoms because somebody doesn't want to go to work. So the next time you don't want to go to work and you're thinking about making up a physical or psychological system, you are malingering, okay? Then we see substance abuse, which we know has gone up in just ridiculous amounts across the United States. This can be an addiction to tobacco, alcohol, medications, or illegal drugs. Alcoholism is a chronic alcohol dependence. This is somebody who may drink 2 cases of beer a day. They can't go without it, or they would actually go through DTs. And again, that's delirium tremens. And again, that is a sudden severe mental change or seizure caused by the withdrawal of alcohol. Again, that drug abuse, using illegal or recreational drugs, or misuse of prescription drugs. And then we have the drug overdose, whether it be accidental or intentional. And we're seeing more and more of that. I don't know, you guys are probably too young to read obituaries, but it is it is staggering the amount of young people that are dying because of drug overdoses. Even with the onset of providing Narcan to people, we're starting to see a huge increase in deaths because of drug abuse. Then we have gender identity, which is gender dysphoria, which is the person identifies himself or herself opposite to what their biological sex is. So if you were born a girl, you may feel like a guy, or if you're born as a guy, you may feel like you should be a woman or girl. There are medications out there, psychotropic drugs. Again, they actually work on the central nervous system and produce temporary changes that can affect the mind, emotions, and behaviors. There's antidepressants, and there's tons of different categories. Those would be determined by the physician on what's going to work best for the patient. They prevent or relieve depression. We see antipsychotic drugs. These are going to treat symptoms of severe disorders of thinking and mood. So there's a number of different types of drugs out there. And anxiolytic drugs. And again, they're going to temporarily relieve anxiety and reduce tension as well. A lot of these medications that we just talked about can be a controlled substance. So again, we have to be careful using them because they can become addictive in nature. There are mood stabilizing drugs, so they treat mood instability and bipolar disease. We have stimulants, which increase the activity in certain areas of the brain to increase concentration and wakefulness. That's going to be our ADHD medications. The problem is, if we overuse them, it can actually trigger sleeplessness and can cause heart palpitations. So we really have to use them properly. Psychological therapies, we can have psychoanalysis, and this is when they determine mental disorders stemming from childhood, and they gain insight into how people are feeling. Behavioral therapy is different. They focus on changing the behavior by identifying the problem behaviors and using reward behaviors if they do it differently. Cognitive behavioral therapy focus on changing thoughts that affect a person's emotion and action, and hopefully that will attempt to change their problematic beliefs. And then there's hypnotherapy, which is producing altered states of focused attention using hypnosis. So people will do that for trying to quit smoking. People will do it to not eat. There's a whole bunch of different things that hypnosis can be used for. The last thing, make sure you are reviewing the abbreviations on page 325 from Alzheimer's disease to ALS, ADHD, cerebral palsy, cerebrospinal fluid, EEG, all of the LOC is levels of consciousness, lumbar puncture. So please make sure you are reviewing those abbreviations. Thank you for listening.